Hello, and welcome once again to Awkward Conversations. I'm your co-host, Amy McCarthy. Today we're revisiting an episode from our second season, which covers a topic close to many of our hearts: preventing drug use among college students. In this episode, we'll delve into the challenging and vital role we continue to play in our children's lives as they step into the world of higher education. We'll discuss the importance of making smart choices, reasons students may experiment with drugs, and how to choose a college that takes substance misuse prevention seriously. So get ready for some candid and potentially life-changing discussions as we revisit one of our most impactful episodes. Let's dive in.
Hey everyone, and welcome to this episode of Awkward Conversations. I am your host, Jody Sweeten, and I have some really wonderful guests today. We are here talking about preventing drug misuse among college students, which is obviously a really critical issue to talk about. I am very excited to be joined today by Rich Lucy, who is the Senior Prevention Program Manager of the Community Outreach and Prevention Support Section for the DEA. Welcome, Rich. Thank you so much for joining us.
Sure thing. Glad to be here.
Absolutely. And also joining us is Dr. Sally Lanowski, who is the Associate Dean of Students, Off-Campus Student Life and Community Engagement at the University of Massachusetts Amherst. Sally, thank you so much for joining us today.
Thank you. I'm looking forward to it, Jody.
And you guys may recognize her from season 1 of Awkward Conversations. We have Seychelles Mizell with us here today. Hi, Seychelles.
Hi. Thank you for having me.
Yeah, you played Rosie in our season 1 of Awkward Conversations that people may remember you from, and you did such a great job. And you are a recent college grad, so we are really excited to have you as a part of our conversation today. And of course, Amy McCarthy, our LCSW licensed clinical social worker from Boston Children's Hospital, who is here with us to give a professional standpoint from all of this that we're discussing today. So hi, Amy.
Hi, I'm super excited to be back. Thanks so much.
Today's episode, we are talking about preventing drug misuse among college students. Kids are going to be going back to school, going to be leaving for college. It's a huge transition period. Recently, college students were asked, what are the main reasons for drug experimentation? And the first was the ease of drug availability. 2 was the lack of parental influence, which I know is a huge point. 3, the normalization of drug use among peers. And 4, the low perceived risk of harm from drug use. And those are 4 main reasons that are coming from a poll of young people, college students themselves. Since we have a college student here, I would love to hear from you on any of those 4 points. Are those things that you identify with? Are those
I've gone to college in 2 different parts of the country, and I noticed there, depending on the area, there was specific types of drugs that were more normalized than others because everyone would either be buying it or selling it or knew where to buy or sell it. And since, like you said, there are no parents around, a lot of people might have not experimented in high school. So then they feel like their freshman year is the time to try things that they hadn't done before. So I did notice that. Also, with the normalization is a lot of, I don't want to say peer pressure, but a lot of they're doing it, so might as well. It's that mindset. Like, I might as well just try it because they are.
Right. And I think as parents and people, we'd also like to think that peer pressure is something that younger kids deal with, or maybe high school. And once you're out of that, like, everyone's more adult about it. And we all face peer pressure amongst, even as adults. Even when you're older, when you're 18 and able to make those decisions for the first time, oftentimes those decisions are heavily influenced by the people around you. Now, what were the 2 places that you went to college at, Seychelles, that you noticed sort of a difference?
In the Midwest and then Southern California. So I noticed in the Midwest it was easier to buy alcohol when you were underage because it was just given out. And then going to Southern California, you have the party scene environment, which is coming into the college environment. So the 2 clashing together is they're all doing it and we're here, so we might as well just try it.
Dr. Lanowski, what do you notice when kids are coming in their freshman year that has a huge impact on whether or not they get involved in either drug use or alcohol use, and whether it potentially turns into abuse?
I think one of the things we notice when students are arriving on campus is that excitement for this is all new and everybody is like me and I want to fit in, I want to make friends, I want to be popular, and I want to find my group quickly. And so sometimes that can lead students to try to wander to look for parties or look for social environments where they think they're going to have that full-on college experience. And so they may actually go off campus or go into situations where there's more risk than they're accustomed to because they have an expectation that this is college and it's going to be the big time. On the flip side, we see a lot of students who really don't want to be part of the party scene. They come to campus because they want to study, they want to do well, they're interested in sports, they may be athletes. And so they don't pay much attention to it. They just jump in 100% with what is the university going to offer for me.
Rich, I know you do a lot of community outreach too, obviously in your position with the DEA. Do you find that this is an age that people are introduced to a lot of new experiences and a lot of new drugs that maybe they haven't been before, particularly when going to a larger college campus or something outside of maybe their hometown?
Yeah, so it's interesting, the 4 reasons that students mentioned, because they align really well with the work that I do around the country, that Sally does around the country and on her campus. Lack of parental influence, for example, we know that for college students, and maybe we'll talk about the pandemic effect later because I don't think we can ignore that happened. But the first 6 weeks on campus are typically the most at-risk time for college students, especially if they're for the first time away from home. They're no longer under any form of parental influence. That is a very risky period of time. The normalization issue as well. So I don't want to get all statistics on us, but I do have a couple that I want to mention. So there are a couple of national studies that we always keep our eye on. And for marijuana use, the perceived risk of harm for 18 to 22-year-olds is only at 21%. That means 21% of 18 to 22-year-olds, of which college students are a big chunk, only 21% see any risk in using marijuana. And that's the lowest that's been in almost 4 decades. What we know in prevention is when that perceived risk of harm goes down, the usage rate tends to go up. So we shouldn't be surprised when we find out that about 1 in 12 college students are using marijuana on a daily or a near daily basis. So, and just on the other 2 issues that came up, in prevention, we're always looking at easy access, easy availability, and changing norms. And if the norm within the family, within the school, or within the community is high risk use, that's a hard norm to break. It takes a long time to change that norm, but that all of those things align very much with the work that we do in prevention.
And I wonder if with the rise in fake and counterfeit medication that's out there that's flooding the market, that we're seeing increases in fentanyl, accidental overdoses, and things like that, has the perceived risk of harm of young college students jumped up in response to some of that going on? Have we seen that they're a little more wary of those sorts of things?
Yeah, interestingly, in both the lower grades, so there's another part of that study that looks at 8th, 10th, and 12th graders, as well as college students. The perceived risk of harm for things like cocaine, heroin, those are still high. It's when you get to like marijuana, for instance, that you run into that issue. I'm glad you brought up the issue of fake pills, because that's why DEA, we started a new awareness campaign last fall called One Pill Can Kill, because of this huge influx in fentanyl that is being pressed into these fake pills.
Rich, I'm really glad you bring up the statement of one pill can kill. We actually are going to do an episode later on in our series here talking about that, because it's such a huge problem. And it's so scary right now that it really is one pill, one of anything that can have it accidentally. So I know that's something that we really want to focus on, but I'm glad that we brought it up here.
And unfortunately, you mentioned, we talk about opioid misuse, significant epidemic in our country. But as Sally will attest, being actually on a college campus, be interesting to hear what Seychelles may have to say on that. But the prescription drug class most misused by college students are the non-medical use of prescription stimulants. And it's because they think that if I take a Ritalin, an Adderall, it's going to get me a better grade. And you know what? If you've been diagnosed legitimately those pills, absolutely it's going to help you with your concentration and focus. If you're looking to take those because you think it's going to get you from a B to an A C to a B, there's no research to indicate that is true. So unfortunately, students college students are looking to score whatever these prescription stimulants they can. Again, part of this misguided belief. So they're getting them from their friends, teammates, coworkers. They have no idea where those drugs are coming from. And that's where you run into the issue of fake pills, counterfeit pills pressed with fentanyl. And now we end up with the overdose, fatal and non-fatal overdoses that we are seeing across the country. So I'm glad you brought that up.
Amy, I wanted to talk to you also. I know we're talking about college students and sort of kids that are young people, young adults that are getting ready to leave out of the house or are on their way to college in the beginning. When should parents start thinking about this? And I have a feeling it's a lot sooner than the summer before your kids go to college. When should parents start thinking about having some of these discussions with them?
Yeah. I think that's a super important thing for us to talk about. And I think that parents can be so anxious around these types of conversations too. Did I say enough? Did I do enough? And I think it's a good opportunity to remind parents that some of these things are tied to so many conversations that they're going to be having with their children throughout kind of their child development. And so just remember and give yourself credit where credit is due, when it comes to the fact, that you've probably already started some of these conversations in some ways. If you're listening today and you're thinking, oh my goodness, wait a second, there's so much more for me to discuss, I would say any time is the right time. So if you haven't had it, even if your child is out of college and you're concerned about these things, there's still time to have these conversations. But when I think about how soon and how early families are having conversations with their children about college in general these days, as early as the end of elementary school and middle school and like preparing for that. So I think as you come into middle school and you're just starting to talk about substances, perhaps in general, and use and availability and things like that, I think that that's a great time to also bring in, let's think about how this will affect your future. And if college is part of your child's kind of path for the future, then bringing that right into it altogether. It's a wonderful opportunity to remind children that, and young adults and adolescents, depending on their age, that also onset of substance use can also put them at risk for kind of being derailed from their path if college is the path that they're looking for. So I think that's a really great opportunity and great time to bring this into the fold.
Got it. So it's never too early. It's never too late. As long as you have these conversations, one of the things is really having a relationship and an open, honest dialogue with your kids, which was what I loved about what we talked about with Awkward Conversations last year. Is there's no perfect way to have these conversations. There's no easy way. You're never going to walk away and be like, that was the best conversation. Just have them. Just start opening up those things, because I think the more your kids feel that you are open to having them talk to you about it. Seychelles, what are some of the things that, as you've grown up, that maybe your parents or adults that you trusted in your life, what are some of the tips and conversations that maybe they've had? Or what were the ways that you gained some positive influence from the people in your life as you grew up having to deal with these situations?
I did notice that there was this constant, don't try to fit in, don't always, like the peer pressure, don't do what everyone else is doing. Because I know when I went in as a freshman, it was like the greatest moment in the world when an upperclassman talked to you. So I just growing up with that reminder from my parents, be yourself. Don't think you have to do what your friends are doing or what someone older is doing. And then when you get into college and the older people are more ahead, you are like battling with yourself to not fit in and to just stick with where you are. So it goes by person. It's definitely hard because you do want friends, you do want the social life. So I know that was a huge reminder from my parents growing up there.
Just being yourself and really honoring who you are and living fully in that. I love that. And that's such a huge message that parents are always trying to give their kids. And it's nice to hear that kids hear us. and I think parents also need to remember that too. Even if you think your kids are tuning you out, even if you think these conversations aren't having an effect, the fact that you are opening that door and that you're repeatedly bringing it up or laying things out on the table to open up these conversations, that's one of the most important things I think that parents can really do. Being a dean of students on campus, what are some of the things that incoming freshmen maybe can do? What are some of the ways that they can get involved? What are some of the ways that they can jump into campus life without having to rely on the party scene as the only way to meet people and make friends?
Oh, great. One of the things is that campuses are really designed to welcome students. So during the first several weeks of a semester, there are tons of things to partake in. So part of it is talking with your resident assistant in your residence hall, looking at the social media, because we know people don't really look at posters anymore, but checking out the social media to find out when's the involvement fair? When's the activities expo? When is the rec center open? When can I go learn about campus jobs? And so there will be all sorts of events with barbecues and students and tables and opportunities where we are opening our doors to welcome you here. We're excited you're here. We want to see you. Getting outside of your room, making a trek across campus, go exploring the student union and knocking on doors, looking around. Take your eyes of a tourist into this new environment and look around and see what you're like. Oh, if I played soccer in high school and I'm not a D1 school, I'm maybe not going to play soccer. Hey, there's intramurals. Let me find out when that is, because then you'll find something right away.
I know sometimes that can be really key too, is being like, okay, what are the things that you want? What is your schedule going to look like? Are you going to have a job? Are you going to have intramurals? Are you going to have tutoring? What are those things? And really helping put those into place, I think, with your kids before they get to campus.
Yeah, I think a lot of times for students and parents, there's a lot of focus on your academic transcript and getting the perfect resume, right? So that I want to make sure I have all these educational opportunities and internships and co-ops and jobs and things like that. But you also want to make sure that you're taking care of your mental health scorecard, right? So what are the things that make me happy, that make me feel fulfilled, that make me feel challenged and relaxed and supported, and making sure that you are seeking those out as well so that you're well-rounded and have a good social life in addition to your academic success.
You're watching Awkward Conversations Season 4.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Welcome back to Awkward Conversations Season 4. Talking about campus tours and things like that. Now, what are some of the things that, when parents and their older kids, young adults, are looking at schools, what are some of the really important questions that they should ask?
Sure. I would say one thing from the beginning is choosing a college or university is a family decision. As much as it often comes down to finances, it comes down to location and the school reputation. Looking at the academics, you look at the athletic facilities, you look at the housing offerings, but you also want to take a look at the campus culture and the local area. What is it like? What is the area where the university or college is located? Are there lots of bars promoting drink specials? Are there cannabis dispensaries on every corner saying, welcome college students or welcome back, that sort of thing? Are buckets of beer advertised? That can tell you a little bit about the climate of an institution and its local area that you may not get on a tour. I always like to say, inquire about the campus and alcohol and drug policies. It should be easy to find in 1 or 2 clicks on the website. Ask the questions during the tour. Ask the administrators how they uphold underage drinking and drug prevention, what resources are available. Ask about housing. Do they have substance-free floors? Is there recovery housing? And more importantly, when you ask the question, how do they act? Are they like, oh, yeah, we have that, but not too many people like that? Or, oh, all of our halls are substance-free. If you get a dismissive or a defensive or kind of a silly parent asking this question, that can tell you a little bit maybe about the social norms there or in terms of what the students may be expecting when they arrive. I would also ask about Greek life. Is there a Greek life presence? How important is that for the social environment? Take a drive off campus, look at the chapter houses. How well managed do they appear? Same thing. If it says drop your freshman girls here, that's going to tell you something that you want to avoid.
Yeah, I'm glad Sally mentioned all of those because it's interesting that we frame all of this under awkward conversations, but there are natural opportunities. to have the conversations. And sometimes I think the more awkward conversations happen when you're not prepared to have the conversation, right? And I think, as parents, other caregivers, and it really isn't just the parents. We know that the grandparents are involved. We know that brothers and sisters, aunts and uncles are all influencers on a child and emerging adults, those who are going off to college. The tour that you're getting on campus, what are they looking to do? They're selling you a product. And that's not to minimize the experience. They are trying to entice you to tell you all the good things about their campus, which they should be doing. But your tour guide is likely not going to know all of the ins and outs of the examples that, like, for example, what Sally just talked about. So try to get an appointment with most likely the student affairs office. That's who you want to talk to, because that's a lot of times where the prevention activities and services fall under. And if you can get even just that 30-minute conversation, not even as high as the VP for student affairs, but an associate or someone else, and just talk to them exactly what Sally talked about, you will come away from that so much more informed, for better or for worse, about, again, it comes back to this culture issue. So I'm glad that Sally mentioned all those specific examples on a campus.
Now, in addition to obviously drug prevention and things like that, what are some other important statistics and culture things to look at when looking at schools?
One thing that is required for all campuses is the Clery Report, which is the Campus Security Act in the U.S. Department of Education. Every year, campuses must report their crimes publicly. So that would include liquor law violations, any drug violations and things like that. That can give you a couple indications. One, if it's a large campus or one with a full police department, there may be more enforcement and more reporting that's happening. So that doesn't necessarily mean that it's a bad indicator, but it can also tell you what the trends are. It also will tell you what resources are available. So that is publicly available. All campuses have that. And that is something to delve into as well.
Okay, great. Yeah, those are also really important things to look at when choosing a school. Seychelles, what were some of the things that, as an incoming student, that you were looking at that were important to you, and what were some of the questions that you had about campus life and culture and things like that?
Yeah, when I was getting into school, it started to become really popular for YouTube vlogs of students to document what their rooms look like, what the school looks like, and that is your little glimpse into an actual student's life on camera versus talking to someone in a higher up office. You can see the actual student living their life and what they're doing, especially like what their housing situation looks like. You want to see what the dorm looks like, if they're in Greek life, see what they're doing as far as what they're running on campus, and then also what resource centers are available on the campus. So whether it's a racial identity or sexual orientation or like deaf studies, things like that. So what resource center would be specific to my identity is a big thing, because when you have questions like the drug prevention or mental health needs, you might feel more comfortable to go to your specific resource center, especially when you're first coming in. That is a big thing. And what is around the school, I know, plays a huge part. Grocery stores or shopping centers or leisure activities, like what can I do off campus, and what is happening on campus. And I think social media has been a good way to be able to see that, so you can see pictures. I remember I was like looking through Instagram accounts of people and all the different clubs, and just getting to see it physically happening was a big thing.
That's actually really smart. And because I'm 40, I was like, oh yeah, I wouldn't have even thought to have done that. But of course, the young people are like, let me see what an actual experience is, and go to different vlogs and things like that. So that's actually a really great suggestion and a really great window into what's actually going on campus and with students that maybe the student tour won't show you or the office won't show you. Now, Amy, I also wanted to ask, I know for myself, my own experience in college, those first 6 weeks were a nightmare. I got sober. One of the first times I got sober and really started trying to figure out my relationship with drugs and alcohol was at 18 years old and in college. And one of the things that I realized I hadn't asked a lot of questions about was, what was the mental health care like on campus? What were some of the resources, drug and alcohol programs, things like that? Are there questions, Amy, that parents and young people can ask for if their students are in recovery? I know Sally mentioned recovery houses, substance-free floors, things like that. What are some of the things that you have found important to ask about maybe students that are in recovery?
Yeah, I think along with what Seychelles was mentioning around resource like centers on campus, counseling centers are a huge aspect of college life. And in recent years, with the mental health kind of crisis, expanding it, as much as it has, unfortunately, I think colleges have really bolstered the support that they offer on campus, which is a wonderful thing. And so on those tours, on those YouTube vlogs, which actually it's a hot tip, Seychelles, that I hadn't thought of before, are people talking about those things? Can you ask those questions? If that's not featured on the tour, could you also seek that out and go and look and see the center while you're there and visiting? We have many families who actually talk about that in their work with us at Children's Hospital. Like Dr. Lanowski had mentioned, the substance-free living is a common occurrence on a lot of campuses. So whether that's an entire separate building, whether that's a floor, and even beyond that, sometimes there are things like quiet living or just living in learning communities that might entice a student. And I also think, as was mentioned previously too, resident assistants and resident directors are a huge component of mental health care on campuses, and especially if you're living on campus. And knowing that you have that resource at your disposal right down the hall or in the next floor, and utilizing that, I think, is a really important way to get support on campuses, and especially in those beginning weeks.
Absolutely. The beginning is that transition into college life is really difficult. I know I struggled immensely. My first semester of college was a really rough time of my life. And I know one of the things for me that I was most terrified to do was to call my parents and feel like I had, quote unquote, failed at launching into college life because I was struggling with addiction or I was struggling with my alcoholism. My grades were terrible. I didn't know. I ran into a lot of problems. And I think both for parents and young adults, the most important thing to realize is you can always call your parents. Your parents will always want to hear from you, or someone trusted in your life. If you are struggling, reach out, whether it looks like someone on campus, whether it looks like calling your parents. I think about it now. Gosh, I wish I would have called my parents so much sooner into some of my struggles when I was 17, 18 years old, because I know that they just wanted what was best for me. And I wish I would have used some of those campus resources, or at least known that they were there ahead of time instead of trying to scramble around and find out after it was too late and after I was trying to piece my life back together. So I think just something that I want to stress as a parent to other parents also is make sure that your kids know they can always call if they're 20 years old and they're call. It's okay. Open the door. Say I'm struggling. Figure it out. And that goes back to, I think, what we've all been talking about too, is that relationships are the key to a successful send-off of your young adult into college life, independent life, all of that. These relationships start getting built, like Amy was talking about, in middle school, 8th, 9th, 10th grade, and they continue on. And I just know that leaving that line of communication open is it's the one thing that we always go back to. It's why my shirt says listen on it. One of the most important things that parents need to do is listen. Really, I know we get so caught up in wanting to give this great advice and tell our kids how it should be done. And I think sometimes the biggest thing that we need to do as parents is just listen. Rich, we were talking about having these conversations and continuing these conversations. The job of a parent is never done.
No, it's not. And I'm glad Amy brought it up earlier. It's never too early to start the conversation with your kids about the issues around drugs. And there is no end point. It's never too late either. And we know college students are under a tremendous amount of stress, and it may not be the parent that they want to talk to if they are struggling. And thank you again for sharing your personal story about this, because that really, I think, opens it up for a lot of individuals. So it might be the RA, it might be a professor, a faculty member, a staff member, somebody that they work with. It's really important to know that they do have somebody to turn to. I know, and Sally knows, on a campus, our number one message is going to be to not use if you're underage. And for alcohol and federally, marijuana is an illegal substance, but we know some states have passed laws around personal use. But even in those states, it's illegal if you're under the age of 21. Our message is still going to be non-use if you're underage. But we also are not naive enough to not know that there are students who are going to use regardless. And campuses around the country, including at UMass Amherst, have tremendous services in place for those students who choose to ignore the law. And they have to have those services in place and those support networks. A real shout out to the prevention professionals around the country who are doing this really hard work.
Yeah, I know for me, like I said, because I struggled with addiction and all of this while I was on campus, I struggled in the dorms. All of that was really hard. It was one of the hardest times of my life in struggling with substance abuse. And I am so grateful for the programs that were on campus. Even if thinking back to them now, I didn't use them maybe as effectively as I should have. They opened my eyes. I had incredible professors who talked to me through stuff, who supported me. There are people on campus and at home who are joining together. And Amy, we were talking also about finding recovery, whether it's 12-step, AA, NA, different 12-step recovery programs in the area for college students.
Yeah, some may even be offered on campus, and some may be in the community surrounding the campus. And also now we live in a much more virtual world. And so there's opportunities to connect across states and across the country. Being able to look into those resources in preparation of getting to campus, especially for somebody who already knows that substance use is a concern for them, I think is a great kind of safety plan to put in place.
One of the things that's also really important to be aware of are some of the signs of use. And Sally, maybe you can speak to some of those on campus as potential warning signs.
Sure. I think some of the signs that we might see are someone stops going to class or falling behind in their academics, requesting extensions on assignments, changing their friend group or losing interest in things that they used to be passionate about. So whether it's a sport or a club or whatever that may be, they're just not as into it because they have a new habit. So they're replacing the time that they used to spend on other things with using or trying to find or recovering from the use of alcohol or drugs. So any change like that, change in hygiene, sleep, and obviously when you come to college, your sleep patterns may change. I often say for families, embracing technology is really a great way to stay in touch with your student in terms of FaceTime. Everybody FaceTimes for everything. So instead of just a phone call, FaceTime when they're in their room and say, hey, show me your room. Let me see your room. What's your room look like? And if it's a mess and alcohol bottles, or you see them hiding things from you, that may say something, right? In terms of what the habits are. You can get a look at how do they look? Do they look tired? Do they look messy, sloppy, that kind of thing? Also see their friends, call them or FaceTime at a time that's unexpected when they may be with their friends and say, hey, let me say hi to Jody. I haven't seen Jody in a while. Those sorts of things go a long way because with technology, we can see each other in real time. And sometimes that can make a difference. I think some of the other signs might be if they're asking for money. Really, when you go away to school, you shouldn't need a lot of cash or a lot of money because your tuition is paid for. You have a meal plan. You probably have a job. Your books will be paid for. So if they're asking for money for things, that could maybe tell you that they're purchasing.
I just want to thank you all for joining us on such a great conversation today. Rich Lucy, thank you so much. Dr. Sally Lanowski, Amy McCarthy, Seychelles, thank you so much. We've got some great perspectives here, and I think it all comes down to communication and communication.
We're out of time today, but join us next week for another episode of Awkward Conversations Season 4. Every day, dozens of people with flashy effects, catchy music, and even explosions are making their way into your home, whispering into your kid's ear that it's okay to make bad choices. And to you, they're strangers, but to your kids, they're intimate friends.
The two places that you have to insist that your kids are not on their screens are in their bedrooms and at meal times.
That's hard.
That the more empathetic a kid is, the less likely they're going to be influenced by celebrity culture. All you have to do is sit down with them and just watch a video they're into and say, well, what do you like about this? What do you think this person is experiencing? What would you do in that situation? The more you get the empathy muscle growing, the more protected they're going to be when you're not around, which is what you want. it's really the parent that has the most influence. So I think that's really great we're having this conversation, because I think we can really empower parents to do something about their kids who are on their screens all day long.
This is such an exciting tool to think about to help build that, that individualization developmentally for teens.
Kids are at an age developmentally where they're trying to figure out their identity, and there's a celebrity on there feeding that as well.
Oftentimes celebrities are singers or actors, or they have, creative outlet, but influencers, really, it's in the job title. They're there to influence people on social media.
It's less about I want to do what that influencer is telling me to do, more I want to be an influencer myself. I can do that myself.
Dr. Cooper, thank you so much for joining us today. This has been such a great conversation about really, parenting the child that you have and having those conversations.
Make sure to check out GetSmartAboutDrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.